disease. And the contents are here. Introduction. This is normal labyrinth, and the other side showing is membranous labyrinth of Meniere disease. Look at it, it is inflated and it is a bit constricted. Now, how you define a Meniere disease? A Meniere disease is an idiopathic endolymphatic hydrops is a disorder of inner ear where endolymphatic system is distended with endolymph. It is characterized by spontaneous episodes of attacks of vertigo, sensorineural hearing loss, which usually fluctuates, tinnitus, and often sensation of oral fullness. It is common cause of syndrome of spontaneous vertigo. In 1861, Prosper Meniere described a syndrome characterized by deafness, tinnitus, episodic vertigo. He linked this condition to disorder of inner ear because of why we call it a Meniere disease. Pathogenesis. Main pathology is distension of endolymphatic system due to increased volume of endolymph causing endolymphatic hypertension. This is due to either increased production or decreased absorption or both. If there is defective absorption, it leads to raised pressure in the cochlear duct. That results in distension of it and rupture of retinar membrane, mixing of endolymph and perilymph that results in vertigo, ischemia, and there is also vasomotor disturbance. Now, anoxia of stria vascularis capillaris, increased permeability, results in transudation of fluid, increased production of endolymph. And allergy, sodium and water retention, hypothyroidism, it is 3%, and autoimmune, bacterial infection like syphilis, and viral infection like mumps. Recurrent attacks of spontaneous vertigo, RALDID. Now, it's a simple clinical features of vertigo. Then there will be hearing loss and tinnitus and associated nausea and vomiting. Definite Meniere disease, probable Meniere disease, or possible Meniere disease. If there are two spontaneous attacks of vertigo, each lasting more than 20 minutes, it means it is definite Meniere disease. And there should also be hearing loss and tinnitus. If there are more than 2 attacks of vertigo and unilateral hearing loss and tinnitus and oral fullness all at the same time, then there is probable Meniere disease. And in possible Meniere disease, 2 attacks of spontaneous vertigo without any auditory impairment. Otoscopic findings in examination, we have no abnormality in tympanic membrane, there is nystagmus, and there are tunic fork tests indicate sensorineural hearing loss. Puritan audiometry shows sensorineural hearing loss. Speech audiometry also shows that there is discrimination score of 55 to 85%, which differentiates it from the retrocochlear lesions like acoustic neuroma, in which there is a speech discrimination ability is impaired. To differentiate it from retrocochlear lesions, we also have a recruitment test positive in it, and that is negative in acoustic neuroma, and CC test that is more than 70%, and tone decay test which shows less than 20 dB decay, and which is more than 20 dB 25 dB in acoustic neuroma. Retrocochlear and cochlear lesion, the differentiating points. Puritan audiogram shows that there is sensorineural hearing loss in both, and speech discrimination score is 90%, below 90% in cochlear, but very poor, it is almost 20 to 30% in retrocochlear lesion. Rollover phenomena is absent in cochlear lesion while it is present in retrocochlear lesion. Recruitment is absent in in retrocochlear region, but it is present in cochlear region. CC score and threshold decay, as I have already experienced. Pedal reflex will be absent in retrocochlear region because there is damage to fission or sometime, and it is present in cochlear lesions. BERA is a very important test, and it also helps in differentiation between the retrocochlear and cochlear lesions. Now, electrocochleography is the most sensitive and specific test for Meniere disease. Variants of Meniere disease. There are three main variants of Meniere disease: the cochlear hydrops, vestibular hydrops, and Lermois syndrome. Uh, Symptoms of Meniere disease are present in cochlear hydrops, but the only symptoms are cochlear symptoms. And vestibular hydrops, there will be only vestibular symptoms, and cochlear function will be normal. In Lermois, there will be symptoms, but they will be in reverse order. Now, staging of Meniere disease. Now, there are 4 stages of Meniere disease, and it is only based on the hearing loss. Actually, it is less than 25 dB in stage 1. It is more than 25 but less than 40 dB, and stage 3 there will be 41 to 70, and for stage 4 it will be more than 70. Now, management. Level of anxiety should be controlled, stress should be controlled, and restricts all diet. Surgical care. Now, there are the treatment is medical and surgical. In surgical care, there are 2 sorts of procedure. One is the destructive, and the other one is non-destructive procedures. Now, in destructive procedures, the main rationale is to control vertigo, and there are 2 procedures: labyrinthectomy and intermittent low pressure pulse therapy. Non-destructive surgical procedures: endolymphatic sac decompression, vestibular nerve section, labyrinthectomy, and transtympanic medication perfusion. We will give vestibular depressants in medical therapy and diuretics. Also, vasodilators are given, and steroids, fluid support. Intravenous muscular diazepam is given when to suppress vestibular function and nausea. Please like, comment, and subscribe.